Here's Seymour. It is time for Pet Check. You are a star today. We're going to talk about osteoarthritis. It affects millions of people every year, but it's also a problem for dogs. Here to talk with us about that is Dr. Nina Kivas. She is a board-certified veterinarian of orthopedic surgery, sports medicine, and rehabilitation at the OSU Veterinary Medical Center. Thanks so much for joining us.
Thanks for having us.
So who's this handsome fella?
This is Seymour, and he is looking for his forever home right now. So if anybody out there is in need of adding a four-legged furry friend to their company, he's a great boy.
He's a distinguished gentleman, I can tell. How old is he?
He's about 10 years old, so he was found wandering the streets, so we're not quite sure how old he is, but we think he's about 10.
Oh, okay. You're a cutie. So let's talk about osteoarthritis in animals. Is it a problem?
Yeah, it's actually very common. So we see it a lot in our older patient population, not just our dog four-legged friends, but also in cats as well. And so it's something that we'll see them in older ages when they're starting to slow down. Maybe it's not some distinctive thing that's changed in their life, just kind of getting older, a little creakier. But we can also see it secondary to some orthopedic diseases that might have a surgical component to them that we can actually make things a lot better for them.
So at what point should people, what should they look for? When do they make an appointment with you?
Yeah, so we really recommend yearly exams with your local general practitioner just to get an overlook of what things are looking like. They can often pick up on subtle early arthritis that might not be causing significant changes on a day-to-day basis, but just overall well-being. But we can also see them having more acute onset where they may be having lameness and really favor one leg in particular, where they might have an orthopedic injury that might require something a little bit more than some medical management of the disease.
Sure. So, and what kind of treatment is it usually? Sometimes surgery, but...
Yeah, sometimes surgery, but oftentimes we think of it as kind of three major groups, and one of the most important things for arthritis is just like in people, and that's appropriate weight management. And so our friend Seymour here is very fit and trim, and that makes a huge difference for them for comfort. So working with people to have appropriate weight like our buddy here is hugely important. But then we also want to control their pain, and so pain medications, pain relievers can really help them get over that initially, so that then we can allow them to do some activity modification where we're letting them do things that are the most comfortable for them, but also are strengthening muscles and kind of helping them get more fit so they can be more comfortable.
Well, let's look at Seymour one more time. He is a 10-year-old puppy. He's in good condition. He gets along with other animals?
Yeah, he gets along with nice, calm dogs, and so he could certainly be homed with other pets as well. But he is a wonderful guy, and he's in great shape. He does not have any arthritis right now, so he's ready to go to his forever home.
And where can we find him?
He is at the Franklin County Dog Shelter and Adoption Center, so they would welcome a visit or a phone call to have you come see him and see if he can fit with your family.
His name is Seymour.
Yep.
And he sees more. Thanks, doctor, for coming in.
Thank you very much for having us.